Okay, welcome everyone to the Putting Nature-Based Health and Therapy into Practice International Online Symposium by the Environmental Physiotherapy Association. We're really glad to welcome you to session 2 of our symposium. We already had one really lovely and informative session, I will say earlier this morning, and we're glad to have you here for a session 2 of our symposium with another series of 4 fantastic speakers. I'll ask the speakers to present themselves in more detail, but we will start with Richard Doran-Sherlock from Ireland, an osteopath and nature-based health and therapy enthusiast and researcher. And then Jess Stanhope from the University of Adelaide in Australia, followed by Betina Ringby, who used to be at the UCN College of Denmark, but is now running I'm going to say a company that includes nature-based health and therapy into its diverse activities. And then we'll close with Lousie Sofia Madsen from Denmark, also from DEFACTUM and the Rehabilitation Center Marselisborg, who is an anthropologist and researcher in nature-based health and therapy. So without further ado, I'll hand over the word to Richard, and Richard, you can share your PowerPoint presentation.
Great.
Yeah.
Okay.
Coming up.
Okay. Good morning from Dublin, everyone. I'm here to discuss a paper which is currently under peer review. Philip was one of the co-authors, along with Nicole, who spoke earlier this morning, and Payal Sood, a colleague in the United Kingdom, on critical considerations for developing nature therapy interventions. Now, as it's under peer review, I don't want to go through the paper in depth because the peer reviewers are likely to do what peer reviewers do and make us change most of it. So instead, I wanted to talk about some of the motivations for why we developed this paper in the first place. And specifically, I wanted to share how that was informed by some of the context of working in Ireland. Nature therapy is, I think it's fair to say, having a moment, as in it is not just part of clinical practice or healthcare initiatives or research, but it is something that's in the wider public consciousness. We see a lot of news reports, a lot of coverage on it. And some of these articles that I pulled up here are actually not bad. They cover some of the nuance that I think we're going to discuss a little bit today. But some of them are, well, they cause me concern. If you're talking about nature in terms of boosting your health to increase your productivity under capitalism, it seems a little bit like something, a bit of a red flag to me. Or outdoor therapy is a wellness trend, something you consume, you buy, you purchase, or perhaps most insidiously, it's just as good as a trip to the therapist, which in the context of that particular newspaper, which emphasizes a very neoliberal agenda and emphasizes private healthcare, this is something that we should be very cognizant of. I'm going to start with something very unscientific, an anecdote. Someone I was working with who went to speak to their doctor because they were suffering. They had various aspects of mental stress, mental and emotional stress, anxiety, depression. The doctor said to them, "Oh, you should take a walk in nature every day." This person works in the environmental sector and spends a lot of their time outdoor in natural environments. And it really encapsulated for me a problem with nature-based initiatives, which is just like a lot of the tools that our professions have used over the years, whether it's education or manual therapy or exercise, it can be applied in a deeply reductionist way, as well as something which connects people with the wider world, which connects people with communities, which empowers people, which is a meaningful aspect of the lived human experience. So I'm going to discuss some of the themes that have informed this paper, but I'm also going to do it as somewhat of a nature therapy session. Each of the following slides will include a species that is indicative of a specific biome in an Irish context, so I hope you enjoy it aesthetically, even if I'm talking total nonsense. Reductionism is the thing that inspired the initial writing of the paper. The framing nature-based initiatives within this neoliberal model of is something that it should be resisted at all levels, whether it's community engagement or research. And a lot of the time, nature-based initiatives have been framed as a very biomedical intervention, as in take 2 20-minute walks and your depression will reduce by 40% or something along these lines. And we all know I am preaching to the choir, and I'm speaking to people whose papers have deeply inspired me. I'm not trying to lecture, but this is the reality of how it's often framed in the public consciousness. And I think it requires a concerted effort to resist that. One of the things that a lot of our professions have done really well in recent years is to embrace the complexity, moving away from biomedical models. And now, whether that is the biopsychosocial model or the ecological and active model, or post-humanist perspectives, which I've learned a lot from Philip about, it's a move away from this view of nature as a reductionist intervention and start looking at the broader context in which these things are applied, socially, environmentally, politically. We can say that, I think it's fair to say that nature-based therapies are complex interventions. We have multiple mechanisms of action. We have different mediators, different moderators. We have socioeconomic variables at play. We have ecological factors at play. The idea of getting a definitive outcome from a complex intervention for a complex condition in a complex environment, in a complex society, is a little bit hard to take seriously. So it's really important that we take these broader perspectives, and when we're working either in the research or in an applied project sense or with patients, that these are informing how we're applying these initiatives. The evidence base for a lot of nature therapy is, it has some challenges and some problems. We often have some low quality randomized control trials informing these newspaper articles rather than more nuanced systematic reviews, which are challenging some of the claims and statements therein. One particular issue that we've noted in several systematic reviews is that many of the foundational studies are done in asymptomatic populations. So this is a big issue where you have asymptomatic people exposed to a nature therapy intervention. They get a reduction in depression scores in self-reported metrics. And then that gets extrapolated into, oh, well, nature therapy must be good for treating depression. And the extrapolation is that that can be immediately applied to a clinical condition. And that's something that I think we need to be very, very clear about navigating people through that. We also have in this field a lot of recruitment bias. We know that a lot of the foundational studies, well, the people who are going to sign up to do them are people who have high nature trait affinities. So it's not surprising that those self-selected groups are going to have a positive experience through a nature intervention. We also have epidemiology, and we do see in the epidemiological data, okay, we can't necessarily infer causality, but there's a strong link between green space, blue space, and positive health outcomes. But often that gets very, very blurry, because on a social level, we know that environmental inequality can both reflect and amplify underlying socioeconomic inequalities. This is a challenge that also requires a little bit of nuance and navigation. In terms of the environmental inequalities, these are often framed in terms of access, transport. But two issues that I don't think are addressed as often are the politics of land ownership and the historical aspects of colonialism. And I'm going to talk about two specific Irish examples here. That the first relates to the politics of land ownership. It's an island in the Atlantic. We have a population currently of about 5 million in the Republic. And a lot of these structures of land ownership were established in the 1840s and 1850s. During the genocide of the 1840s, there was an extensive period of land enclosure, which kicked a lot of Irish off rural landscapes. These enclosures were enforced through grazing rights. Landlords would graze sheep, which are not native to the area. They cause quite significant ecological degradation. So you have this pattern of enclosure, exploitation, a removal of people from land. And this is a story which is repeated in many parts of the world. So when it comes to nature therapies and actually accessing nature-rich sites, we have to deal with both the ecological degradation aspect, but also the historical aspects that many of the structures that are still in place with regards to land ownership and access rights come from deeply hierarchical and violent pasts. One other aspect, as a side note, of colonial impact on Irish ecology is the Cromwellian invasions of the 1640s and 1650s. During this period, which is a period noted for its violence specifically against certain settlements in Dundalk and Wexford, this was obviously a complex logistical military exercise by Cromwell's British soldiers. But during that period, he would pay the equivalent of 1 year's salary for every wolf that was shot. It was an extraordinary amount of money to eliminate a species which is referred to in Irish as Mactira, the son of the land. It was a form of ecocide, a form of cultural erasure. And when we're looking at engaging with nature in an Irish sense now, we have to deal with the fact that what is left is so fragmented by these processes. And that means that in this context, restoration and rewilding initiatives are really, really important, both ecologically, culturally, and in terms of developing meaningful, robust nature which people can connect with. Eco-anxiety is something that's also somewhat under-discussed, and there are very few people working in the environmental sector I know of who don't know this quote by heart by the American conservationist Aldo Leopold. But one of the penalties of an ecological education is that one lives alone in a world of wounds. The learning about ecological degradation can be an extremely challenging process to go through. While a lot of nature therapy interventions emphasize the importance of nature connection, and I fully, totally support and I'm on board with that, we also need to hold a certain amount of sensitivity for the fact that there can be suffering that accompanies it. The word, I think, in that quote, which requires changing most, is the word alone. Because going through that process can be a very isolating experience, but if engaging with nature through nature therapy interventions are connected with wider, meaningful political engagement, social engagement, environmental engagement, rather than it being a source, the pain is still going to exist for some people, but it becomes a direction of empowerment rather than one of dejection or depression or despair. In the Irish context, we also have to deal with the realities that a lot of the spaces that we do want to engage with, which are nature rich and have a lot of non-human life, are deeply fragmented and are very, very vulnerable to disturbance. And this requires us to think in really nuanced ways about how nature-based initiatives have to be developed at grassroots level so that we can have robust community health initiatives, which are robust community ecological restoration initiatives, rather than historically, which often has been done where ecological protection and restoration has been a hierarchical process which has excluded people from around the world. It's not going to be easy to balance the need to protect delicate areas with the need to connect people with them, but rewilding, reconnection, expansion, protection, all of these things are part of the toolkit that we can use in this context. In other places, it might be a case of access being more of an issue, but certainly from the Irish perspective, this is a really subtle and delicate challenge to face. We also have to think about anthropocentrism and how we value the natural world, because sometimes this can result, nature therapy interventions can result in framing the natural world in ways which are analogous to extractivism, that they're there for our intrinsic, for human benefit, as opposed to really valuing intrinsic value of non-human nature and embracing our role within it as opposed to outside of it. So the paper that we've put together, it is meant to just be a really quick overview of some of these challenges to help people navigate this complexity. It is not written to be prescriptive or dogmatic. It's certainly something I would hope for it is that people take it apart and reassemble it based on what is relevant to their immediate political, social, environmental, ecological contexts, so that they're able to develop appropriate nature-based interventions which take into account all of this complexity. So these are 2 sites in Ireland, and of the species I've shown you so far today, you would be very hard-pressed to find any of them in the photo of the left, which is a national park. You can see there's a tiny amount of forestry just at the water edge, but if you look at the hill in the distance, it's barren of trees. It is burnt. The few species that can grow there are ones that can survive intense herbivory. It can be quite aesthetically beautiful, that landscape, to see the rock and the sea and the sky colliding together. But it is ecologically heavily degraded, and many of these historical processes have led to this. Whereas the photo on the right is a photo of a glimpse of what could be. It's one of the 1% of the Atlantic rainforest which is remaining in Ireland. And this is absolutely thriving in terms of the abundance of life you can find within it. And a very important part in this part of the world is making sure that we get more of that so people can engage with it while those natural processes take place in their own terms. Thank you so much for your time. Thank you all so much for listening. Thank you to my co-authors. I've learned so much from all 3 of you, and I look forward to talking to you all later in the Q&A.
And thank you so much for a lovely presentation, Richard. That was really, really good. Yeah, I look forward to the chat afterwards. I will, be getting, for good reasons, claps and applause, etc. I'll hand over the word to Jess then.
Thank you. I'll just share my screen. Okay, so I'll be talking about nature-based physiotherapy.
Just at the moment, we still, there it is. Okay, yep. Now we have the normal presentation view. Yeah.
Cool, thank you. So yeah, I'll be talking about nature-based physio and highlighting approaches to practice and overcoming some of the challenges that you might face. So this is in part, I guess, inspired by a survey that we did a couple of years ago that's currently available as a preprint. Hopefully in a couple of months, we'll get it through peer review. And this was a survey that we did of Australian allied health professionals who are interested in nature-based approaches. And we're looking at what they were currently doing, what some of the challenges were they were facing, what they saw as solutions or opportunities to enhance the availability of nature-based approaches in allied health. And so I'll give you a bit of a rundown of the key points from that paper before talking about the main part of my presentation, which will be more about the approaches that we can use. And so physios were engaging in a really wide range of nature-based approaches. These included outdoor activities, which were often things that we would do indoors and just applying them outdoors. So, there's a range of things that we do that would be quite inappropriate to do outdoors in terms of, things that involve disrobing and so forth. But a lot of those physical activities, rehabilitation activities can certainly be done outside. And we saw that in our study sample. People are also bringing nature indoors. And so this might be putting plants around the place. It might be opening windows or even just opening blinds so that people could actually see the outdoors if they actually had a view of nature. And then importantly, physios are also engaging with advocacy and the provision of natural spaces. And so this included things like in a care environment, so around their clinic or their hospital setting, making sure there was a garden available, but it was also in the general community as well. So advocacy for things like tree canopy cover to be enhanced. So it's a really wide range of things that we can be doing and that people are doing, which is fantastic to see. But there are also a really wide range of challenges as well. And these were categorized in terms of the patient and the client, the allied health professional themselves, and the external factors. So for the patient or client, this might be things like the time or motivation, particularly when these nature-based approaches were being recommended for them to do in their own time. Could be a fear of the outdoors as well. So people mentioned that some adolescents actually feared going outside, but also people who hadn't had a lot of exposure to the outdoors. So particularly people with mobility disabilities. But the other thing that came through around the challenges around the patient and client was that it wasn't viewed as being part of what they expected for allied health. So there was this issue in terms of people's preconceived ideas about what allied health is. For the allied health professionals, some of the challenges again were related to things like time, but also the expectation came through as well for the allied health professionals. So there was a concern around, was this actually part of scope of practice, and what would other health professionals think if they were to engage in these nature-based approaches? And then there was a range of external factors as well. So things like the weather, but also challenges around policy that the hospital might put in place, funding and insurance. And so then we asked people to propose solutions to these challenges. And what really came through was this need to legitimise it as being part of allied health practice. And the two things that came through that could really drive this legitimisation was increases in the research evidence, but also increase in education. And this wasn't just education of health professionals, but also the general community. And so if we had these two things, it would lead to an improvement in legitimisation. And then if you have that, it's easier to take care of the rest of the issues that were raised. So if it's viewed as a legitimate part of allied health practice, then we can argue for funding. We can justify it being covered by insurance and having spaces available. So this is what really came through with our data. But I've been thinking a lot about it more recently and how we can also drive legitimisation by using the frameworks that we are generally already using as part of our physiotherapy practice. And so this is what I'd like to highlight today, so that as our evidence is emerging, we've got ways of having these conversations with people, both in terms of the patients and the clients, but also other health professionals. So the ICF framework provides us with a way of thinking about this. And so the ICF framework was published about 20 years ago and is from the World Health Organization. And it was really at this time where there was a shift from this very biomedical way of thinking to more of a biopsychosocial model. So while historically our focus would have been on the health condition, and even now a lot of our patients will come in with a diagnosis from a GP, or they've come in for a sprained ankle, and then we need to unpack what the rest of the story might be. And so the ICF framework has 5 additional linked components, and this is the body structure and function. So this is changes in the anatomy or the physiology, so still quite related to that the biomedical thinking. And then activity limitations and participation restrictions. So the activity is really a discrete task, and the participation is how people can engage in the things that they would need to engage in for their life. So this might be things like limiting someone's ability to go to work or school, but it can also be recreational activities, and these can of course relate to nature. So it might be something like gardening or hiking. It might be the participation that they're missing out on. The personal factors and the environmental factors are viewed as being contextual factors. So personal factors, things like age, sex, genetics, are all examples. And then the environmental factors is really a really wide range of factors. So when I went through uni, we would use the ICF framework as the foundation for our clinical reasoning. And we would typically talk about things like the home environment, the work environment, or the social environment. We never really talked about the environment in terms of the natural environment and the things that we would be interested in from the environmental kind of physio perspective. But interestingly, when the ICF framework came out, there was also an accompanying checklist, and this provides a really comprehensive list, or fairly comprehensive. It does have a few gaps, fairly comprehensive list of each of these components. So it can really guide that reasoning and guide those subjective assessments. And they do have the natural and the built environment as environmental factors. but the specifics of that are around climate, noise, and light. So there's still a lot that we can bring to this in terms of exposure to nature more generally. But I think what's really important to highlight here is this is a model that's been around for 20 years. It is still being used. It is being taught as a way of guiding our reasoning, and yet we aren't going back to that original source and that original intention around what those environmental factors might mean. And of course, if we've got a model that supports that, it makes it much easier for us to justify this as part of practice. Now, the other big one is evidence-based practice. And obviously, as we've heard, there is emerging evidence, but it's not as strong as perhaps we would want it to be. And a lot of it is in non-clinical populations. So it does have its limitations. We then have the clinical expertise and the patient and client expectation and values. So the clinician's expertise are really key in this because that allows us to integrate each of these components. So while there might be limitations around the research evidence, there might be pockets of evidence that we can draw on. So a lot of the intervention evidence that's stronger is around things like mental health and stress reduction. And so it might be that you're trying to get someone to engage in their activity, so their physical activity or their exercise. And by being able to do that outdoors in a natural environment, you might be able to also reduce their stress because you can draw on that bit of evidence. But we can also think about what are the kind of theories that we've been introduced to previously. And so in the previous session, David Butler spoke about pain and gardening and pointing out the various things that we can get people to focus on. And we know that distraction can help with pain. So if you've got someone who you're seeing and they've got pain or other symptoms, actually getting them to focus on different things can be really helpful. And for some people, actually engaging with nature and focusing on the different sounds, focusing on the different smells, the different things they can see can provide us with a way of getting them distracted from those sensations. Now, with the patient and client expectation and values, as I've already mentioned, that can be a barrier to actually engaging with nature-based approaches. But we can also utilize it. So for some people, we can talk about why it might be important and start to shift some of those expectations, because we often have patients who have a different idea of physiotherapy to what we might be thinking about our role in their care. But for people who are actually already interested and engaged, we can use that. So as part of our subjective assessments, if we're asking people about their expectations of physio, we're probably going to get fairly clinical, biomedical type answers. But we can start to draw this out of them with questions around, what are the environments that you feel safe in? What are the environments you feel least stressed in or most relaxed in? Where are the places where you've got some positive distractions that we can better utilize? So we can bring all of this together through our clinical reasoning and things like person-centered care to really justify why we might be using nature-based approaches. Now, obviously, this isn't going to work for everyone. It's not going to be appropriate for everyone. So although there is that bias in the research evidence around people being self-selected into these trials, for people who already have that affinity and that interest in exposing themselves to nature, then they can actually benefit. And so it's working out which clients and patients this might be beneficial for. So I've mentioned patient-centered care a little bit, but one of the things that we typically encourage people to do in rehabilitation is engaging in meaningful and functional activities. So we're trying to have the goals that are set by them, obviously with some of our input, and then we can also think about the context in which we do these activities. So when we see a patient and we might ask them, what are your goals of therapy, particularly if they're in a rehabilitation or hospital setting, they'll often come up with things like, I want to go home, I want to be able to go to the bathroom by myself, which are all really, really important goals in terms of maintaining independence. But often the conversation stops there. We don't go to that next level of what is it that is really on your wish list? What is it that you're able to do 10, 15 years ago that you don't feel confident doing? And how might we be able to get that back into your life now? So it might be that you've got someone who historically has really enjoyed gardening, but over the last 10 years, their health and their mobility may have declined and they've no longer engaged in their garden. They might still be able to appreciate it from the window or the porch, but they're not engaging with it. So can we rehabilitate them to a point where they can engage with it? Can we put supports in place so that they can have someone with them when they're doing their gardening so they feel safe? Or can we actually engage them in a community gardening group where they're going to have other people around them, so it's going to be much safer, and they might have things like raised garden beds. And so really thinking about our role in encouraging people into those activities that they really want to be engaging with can be beneficial, irrespective of what the activity is. But certainly things like gardening and hiking and bird watching and nature photography are all things that people may find meaningful to them and that we can encourage them to do. Now, this point of context mattering, I think, is kind of linked with this. So if you've got someone who's wanting to go home independently, you've worked out how far they need to walk to get to the letterbox or to get to the car or something like that. And often we'll get them to kind of walk that distance in an indoor environment that's, you know, often a hallway in a hospital. So it's very, very different to the context we're wanting them to then apply those skills. When they go home, their home environment indoors might be okay, as long as they don't have tripping hazards to worry about. But certainly that outdoor environment can be very, very different. And so part of what I would be encouraging people to think about is how do we actually test their ability to problem solve and identify hazards, and also to examine whether they're able to transfer those skills that we've done in an indoor environment into a different environment. And certainly getting people outdoors, getting them into different outdoor environments can be a way of doing that. So really thinking about, can they do it in the environment that we want them to be able to do that in? And this is really important because as people's mobility and their health decline, their worlds get smaller and smaller. And so a couple of years ago, we wrote an opinion piece about this. And this was, I guess, inspired by COVID-19. So we were hearing a lot of complaints about lockdowns and isolation after people have been traveling and those kind of things, which of course were a challenge for most people to deal with. But people were talking about the fact they couldn't go outside, they couldn't get fresh air if they were in a hotel room where they didn't have windows that opened, they couldn't exercise and be socialising in the way that they historically have. And what really struck me was this is obviously an issue, but it's something that for a lot of our patients and clients, this is actually their normal life. So if they're in an aged care setting or a long stay in hospital, they can't necessarily go outside, often without someone actually taking them. But even if that's the case, there's still limitations on how far they can go. If someone is even living in the community and they don't have the confidence to safely go outside or into something that's a bit more challenging, perhaps like a park, then they're not going to do it. Or they might do it and do it unsafely. So we need to be thinking about what is it that we want people to be able to engage with and how do we get them? And importantly, making sure that it's with what they're wanting to do. So although safety is a really big concern,
Looks like
to engage with nature. And so this is really key because people's mental health and their social integration might suffer as a result. So what I'd really encourage you to think about, and hopefully tonight has given you a few clues as to how to think about, is not viewing nature-based physio as a separate area of physio, but actually viewing it as physio. It's already what we are doing or should be doing. It's using the structures and the frameworks that we already use, but just thinking about them a little bit differently. So having those more in-depth conversations with people so that we can really highlight what's important to them and we can reach a shared understanding of how we can progress their care. So hopefully this has given you some hints, and I really look forward to the conversation later on in the session. So thank you.
Wonderful. Thanks, Jess. Brilliant as always. You just dropped out there for one part of one sentence, but hopefully we can pick it up in the discussion afterwards. Yeah, so I'll hand over the word to Betina now. No.
Thank you. I will share.
Mm-hmm.
Mm-hmm.
Yep, there it is.
Yes. First of all, I would like to invite you on a short journey I would like to for you to close your eyes, and I will guide you when to open them again. So please take a deep breath and recall a moment of planting a sprout, a flower, or a seed. Did you get your hands dirty? Did you touch the soil? How was the smell? What were the colors? How did you feel? Well, I will invite you to open your eyes again. And first of all, I'd love to see how many of you love to be around plants. And often it seems to be a lot of people. My name is Betina. I'm from Denmark, and I have been working within healthcare for more than 30 years as a practitioner, a clinical supervisor, and a lecturer. And in 2022, I created my own company to work with inner and outer sustainability and to use art, culture, and nature as a way to promote, especially mental health. I am involved in an initiative called Guidance to Connect, and this is the initiative that I will tell you about today. Guidance to Connect started as an innovation project, and I joined in 2021. The concept behind Guidance to Connect is simple. We make urban landscape greener and bring people closer to nature and each other. And we make gardens where there is no place to grow otherwise, or where the soil is polluted. As you see in the picture on the right, there it's not safe to grow anything, so we did it in the huts. We upcycle discarded PVC pipes from the building industry, and PVC pipes are all around us. They are at every construction site, and they are used for water. And bits and pieces are cut off, and leftovers are brought to the landfill. And we collect the pipes from the landfill. We use PVC pipes because it's lightweight and it's easy to handle, even for children and elderly people. It's safe. There is no sharp edges. There is no risk of breaking, no heavy lifting. It's for free, unlike other containers for plants. It's easy to use, and you can turn it upside down. It can even be cut with a handsaw. It's easy to move gardens around and adapt to multiple spaces if the environment change. The pipes, they have been tested safe for growing eatable crops. But however, the recycled pipes are much more than just an example of reuse and circular economy. So Guidance to Connect tries to cultivate more than plants. We bring people together. We nurture a movement of environmental awareness and human connection. So we bring people together to get our hands in the soil, to connect with ourselves, each other, and the world around us. We have done guidance in many different groups and in many different settings in Denmark and in Rwanda in Africa, especially. We have co-created guidance on hospital grounds, in public libraries, in kindergartens, elderly homes, music festivals, environmental festivals, etc. As I have worked in Rwanda for several years, I will talk about the experiences from there and also from a homeless shelter in Denmark. In Rwanda, we teamed up with a local NGO that takes care of vulnerable children. There, we wanted to promote healthier nutrition and educate teenagers. We also set up a garden with genocide survivors in Rwanda that couldn't go to the fields anymore due to mental illness and or physical challenges like having only one leg, one arm, one eye, or alike. There, the main goal was to support mental health and social well-being. And at the homeless shelter in Denmark, we were there to beautify the space and the overall environment and involve as many users as possible for social impact. Garden to Connect is environmental physiotherapy, in my opinion. We have many experiences related to physical, mental, social, and educational impact, and I will share with you some of these examples. For the physical impact, yeah, there are many physical activities in gardening. We have to transport ourselves to the garden by walking, biking, or taking a bus. And even if we take the bus, we have to leave our house to go catch the bus. And we have to prepare the setup of pipes. We might cut them. We carry soil. We plant and we carry soil and plants and water. And it can be quite heavy lifting. We dig and we fill pipes with soil. We kneel down. We bend our backs and knees. We walk around the garden. We grow. We nurture. We have to weed. We maintain before we can harvest. So there are many physical activities in gardening. And for the mental impact, for instance, we experienced that the garden creates a space, a quiet place to study. Some of these children in Rwanda, especially, they have no place to really focus because there are many people and small spaces for them to be. So the garden we made, or gardens, became a place to study and to focus and to breathe. And just be. They don't have many places they can just sit and do nothing. So just for enjoying, and there was no need for, when there was no need for garden work, some of the kids could also just hang around, sing and play music. You see the girl in the middle. She didn't really like gardening, but she loved to be with her friends and she loved to make music and dance. So when we were harvesting, she immediately picked up a cabbage and she started singing and using it as a microphone. And I think all of you maybe have tried to use a hairbrush or something for singing when you were young. So just to see that, how international that is, was really amazing. So it was a space to play and enjoy. And some children in Rwanda and grown-ups in Denmark tried also for the first time in their life to plant a sprout. And it was a very new experience that connected, that the activity was connected with giving life and then nurturing it. So nurturing yourself and nurturing plants is connected. It was also a place to create awareness and to be mindful how to use all our senses in a very loud community. So we could touch the plants, like on the picture there, to touch the vegetables. We could smell them. We could observe some details. Insects came when we were planting. The bees started coming. It was beautiful, the colors. We tasted herbs and vegetables and listened to the sounds. So it was very different from other activities from these people. Also with social impact, for the genocide survivors, it was a way to get out of isolation and meeting, having a meeting space. They couldn't contribute anymore to go to the fields because of the mental impairments, and also some of them didn't have like a leg or arm, maybe only one eye, so they were not able to go to the fields. But all of a sudden, they came out of their houses to go to the garden, to the community there. So it became a place to go to. It became a place to share knowledge, because a lot of them had a lot of knowledge from agriculture and gardening, and they had no place to really share. And also, when we realized how much knowledge these older people had, we made some intergenerational connections between the kids and the older ones for them to teach each other. And for the educational impact, we realized that people have so many stories to tell. And when you work around plants, it's like they just come very naturally. So a lot of people in Denmark, in the homeless shelter, the people there, they could talk about the medicinal use of specific plants, how grandmothers use plants for specific food and healing, about their own experiences with gardening and agriculture. And they knew how to nurture specific plants in a very hot environment if it was a refugee from the south. They knew how to water plants where there is no water. So they had so much knowledge to contribute, and nobody had ever asked them for that knowledge. And also, we gained a lot of practical knowledge. And for the kids in Rwanda, some of them didn't know that a carrot was growing down in the ground and that a cabbage was growing on top of the ground. So there were many, many things to learn. And also the genocide survivors, they could teach us how to make natural pesticide so that we got healthy vegetables and nutrition. We also discussed how to take care of plastic waste and what is reuse and circular economy. And you see the two youngsters here on the right. We did a multiple choice test for them to know about Garden to Connect and the concept behind it. And if they passed, they could be ambassadors of Garden to Connect and teach others. And it was very impactful because some of these kids, they were telling us that now they felt able to teach others, even the ones that had parents. They could teach their parents how to grow things. And if there was another pandemic, they also now knew how to make food. And they had struggled so much during the pandemic. So hearing these kids feeling more confident that they wouldn't suffer so much again if they could grow their own food was amazing. But we also realized there was a creative impact, because when you work with young people, they have all kinds of ideas. So what happened in the youth center was that we started making drums out of pipes, and more kids got an opportunity to learn how to drum and dance and be physically and culturally active in the community. And we also created a dance piece to raise environmental awareness, and we performed in the streets for a public audience. So Helubak Kabango, that you see here on the right, he's a professional dancer, and he was doing choreography with other professional dancers, and we involved the kids also to teach parents how to nurture kids and to raise kids. So we use the symbol of nurturing plants for also nurturing your child. And so what's next? Well, you can go to all our websites, places to look for more information and for writings about what we're doing. We have a website, Facebook, Instagram, LinkedIn. You're very welcome. And then, of course, we have a call for action. So it's like, just do it. Put up a garden, get yourself a pipe from a landfill or a construction site, set it up, and then we'd love to have a picture. And of course, we encourage people to reach out with questions. And we also open for collaborations. And of course, funding opportunities are always welcome, so we can help the initiative grow. So thank you very much.
Thank you so much, Betina. Really lovely and insightful, and I'm looking forward to the discussion afterwards. All right, so with that, the word goes to Louise. You're welcome to share, Louise.
Thank you. Okay, so Hello, everyone, and thank you, Philip and Jessica, for organizing this very interesting symposium, and also for inviting me to being a part of it. This image you see here is from one of my fieldwork studies, and to me it captures the essence and also the motivation for putting nature-based health and therapy into practice. The natural environment brings a human sense to our healthcare systems and interventions, and by moving from the structured environment and healthcare or community center to a natural environment, then we open up new possibilities for connection with ourselves and with others and with nature as well. So one thing I've observed is that outdoors in nature, we simply show up as ourselves. We are not defined by the roles we typically step into as a patient or a citizen within a system. So when you think about it, this shift in setting has a really profound impact. And it also may seem simple to shift the scenery and step into nature. But the healthcare context that is surrounding it is very much complex. So this is where my research comes into the picture in exploring how we can navigate the unique opportunities and challenging of integrating nature-based rehabilitation into practice. So for me, my name is Lousie Sofia Madsen, and my presentation I can see will build very much upon the one given by Jessica. And I am an anthropologist. I have completed a PhD about outdoor rehabilitation, and I work now as a researcher at DEFACTUM in Central Denmark region as part of the practice-based rehabilitation research program. So I also want to give you a quick introduction to the ICF model. And that's to help contextualize how I approach rehabilitation. And in the field of rehabilitation, the ICF model emphasizes understanding, functioning in a more holistic way, considering not just the physical aspect, but also everyday life activities and participation, together with social, environmental, and personal dimensions. So additionally, this model supports a biopsychosocial approach, which provides a more comprehensive understanding of the individual's experience and needs. The focus of interventions based on this model is to support a meaningful life and promote quality of life. And in this sense, the ICF model is central to how I understand and approach nature-based or outdoor rehabilitation. I see it as a resource that can be woven into a more therapeutic and person-centered approach in practice, and not as, you know, a structured intervention in the traditional sense. So, you know, at this symposium, we come from many different cultures, contexts, and professions. So I just want to briefly outline the setting that I'm talking from. In Denmark, our tax-funded healthcare system gives us a high capacity to develop public interventions compared to many other countries. And in the Danish context, we do not have access to those grand mountains, but our natural environments are mostly more cultivated, and the kind of nature accessible from the healthcare centers is often urban green spaces. So the photo here is, it shows the Marselisborg Center, which is a collaboration between the Central Denmark region and municipality of Aarhus. It involves 22 partners, all focused on offering rehabilitation programs to people with disabilities across different types of diagnosis, injury, illness, or accident. And in 2021, a new park in the surroundings of the Marselisborg Center was finalized, designed to integrate rehabilitation, community life, and climate change into one single cohesive solution. So to establish a practice-based understanding of the potential and also contributions of expanding how we understand rehabilitation and take the outdoor context into use, I conducted a 6-month fieldwork study. And this included a combination of participant observation, individual walking interviews, focus groups, and photo voice. And this was to explore the experiences and perceptions of both the people with disabilities and also the health professionals. And in total, we included 115 individuals in rehabilitation and 27 health professionals across professions. So I want to share with you the results from the perspective of people in rehabilitation. And we aim to explore the potential of outdoor contexts within rehabilitation to empower people with disabilities. And what you see here is a figure that illustrates the main findings. And the theme, revisiting the outdoors, serves as an overarching framework, showing that by expanding traditional rehabilitation, participants are given the opportunity to re-engage with natural environments despite loss of functioning. They are able to rediscover what meaning nature provides to their lives, and also reevaluate their relation and connection to nature, supporting their changed life circumstances. And this reintroduction allows illness or the disease or injury to naturally recede into the background, creating space for growth and development on multiple levels. And then we have the theme of building autonomy that focuses on the person in rehabilitation gradually taking on a more active role in their own process and following their intuition and personal sense of direction. And then connecting with community illustrates how the green spaces are highlighted as an important step on the path to finding or rediscovering a place in the community during an otherwise vulnerable period that often for many are spent at home. And in this way, participants experience that the inclusion of urban green spaces in rehabilitation help bring their entire life situation more fully into play during the process. And then we have the last one, which is embodied learning, that refers to how individuals in rehabilitation experience learning through their own bodily experiences in a challenging environment, creating a direct connection to their everyday lives. And then to offer a more specific insight, I just want to share a quote with you. So I'd like you to meet Thomas, who is 69 years old and has suffered a brain injury. And according to him, the outdoors contributes to the physical recovering that is obvious. But it also helps to cheer up the mood because you are outside, watching nature, the smell of grass, freshly mowed, hearing the birds singing, and just. This should not be underestimated. It is not something that you usually think about in your daily living, how much it actually means. But then you're certainly really challenged because of disability and have been for a long time. And then you actually become aware of it. So this quote to me illustrates how nature provides a pathway for us as professionals to actively support people in rehabilitation, helping them achieve meaningfulness in their everyday life. So now I just want to give you a quick run through the professionals' perspectives here. where we aimed to explore their experiences with and perceptions of rehabilitation in urban green spaces. And so this figure illustrates the overall findings. And on the one side, we have the theme naturalistic learning opportunities, which demonstrates how urban green spaces provide a natural learning environment for rehabilitation. And in these spaces, rehabilitation is less structured, moving away from scheduled exercises or specific equipment. It's more flexible, allowing for ongoing adaptation, and also empowers health professionals to take a step back and adopt a more observant and guiding role. So therefore, it offers opportunities for interaction with the environment, which can reveal new insights into an individual's strategies and functioning. So on the other hand, we have the theme rehabilitation setting tensions, which highlights the professional dilemma that can arise from this approach. These dilemmas stem from uncertainty within the health professional about how to apply professional knowledge effectively in a less controlled environment, and how to translate this knowledge into a more flexible, creative approach. And then balancing professional freedom with the need to meet structural demands for instance, documentation, testing, and measuring outcomes. So how do we then go to navigate this middle ground of opportunities and challenges? Just to round off the presentation, I just want to give a few practice implications where we are in a need, from my perspective, at least, of a cultural change. We need a cultural shift within our healthcare systems, moving away from an excessive focus on limitations and risk avoidance towards adopting a strength-based approach. And this means exploring and leveraging the facilitators and resources that support people in experiencing a life filled with meaningful opportunities. And then we also need to challenge the paradigm of documentation. It's crucial to reevaluate what we measure and why. And are we measuring the right outcomes? Are we focusing on indicators that truly reflect a person's well-being and functional abilities in a meaningful way? Or are we simply adhering to traditional metrics? Then we also need to keep support competency development, and to make, because to make nature-based rehabilitation a sustainable practice, we need to enhance competencies within healthcare professions. And this should become a core component of professional education and ongoing training. And then, last but not least, keep it simple. The key is to integrate nature-based approaches bit by bit into existing practices and professional approaches. So start small and then build momentum over time and develop from there. So that will be the words from me for now. And thank you very much for listening and also inviting me. And I look forward to the engagement after. Thank you.
Wonderful. Thank you, Louise. Right. Yes, thank you for lovely, really inspiring presentations. I have all sorts of light bulbs going off at the moment. I have sufficient comments and questions to fill a half an hour, but I want to give other people also the chance to throw in their questions and thoughts and reflections. Before we do that, or as we do that, there's two things. I want to invite everyone who can to turn on their cameras just to enhance a sense of community. I feel that always helps in the Zoom and virtual world. So if you can, if you're at liberty, turn on your cameras, that would be really lovely. We'd love to see you all. And then for questions, I think the easiest way is to just use the Zoom hand sign if you can. That will give us an order of questions. If that doesn't work, you can type in the chat. I'll do my best to try and follow up who else wants to ask a question. Thank you so much for all those cameras coming on. Look at all these wonderful faces. Right. So questions can also be amongst presenters. You're welcome to question and challenge each other as well, and really sort of go into the nitty-gritty. Everything is welcome. So floor is open if somebody has a first question. Don't be shy. Emma, off we go.
Thank you. Thank you so much for all the wonderful presentations. I love to hear all the examples. And I do not really have a question to, to anyone specific, but I would like to relate it a little bit to Richard's presentation, because I've been thinking for a couple of weeks now about how we can ensure that our green spaces or landscapes are remains a source of play and physical activity and rest, while we kind of support biodiversity and climate adaptation. Because here in Sweden, we have a long tradition of being outdoors, and a lot of people are using the same urban green spaces or forests, a lot of stakeholders and organizations. And I myself have used the nearby spaces by providing courses to children. But I have never thought about how I'm affecting that part of nature. For example, biodiversity or a lot of species. And a couple of weeks ago, I was listening to a lecture by a person who's an ecologist and a landscape architect. And she was talking about something called sustainable places, and a project where all these different stakeholders, including, for example, physiotherapists, must collaborate with particular areas or nearby areas in how to restore or save the nature. So I was just, perhaps Richard had something to say about that, because I love all the initiatives, but I also think that we have to think about how we use different areas.
Emma, that is such a wonderful question. And it's a really, really nuanced thing. One of the things that we have in the paper is that for developing nature-based interventions in ecologically stressed contexts, it is going to require multidisciplinary collaboration. If that's healthcare professionals developing programs, we need to talk to ecologists. We need to talk to communities. What I would also say is that the balance between how we interact with nature and how nature can thrive in terms of ecological processes is there is a skew in the research, which is we tend to go, well, human activity here is very good for these species, but those are human tolerant species. And we don't tend to necessarily capture in research very disturbance intolerant species, whether they're flora or fauna. So navigating that is incredibly subtle and requires cognizance of the local politics, history, culture. Something that I think it potentially moves towards is a more ritualized aspect of nature therapy, where it might be a case of, this is an area we don't go in spring. This is an area we play in autumn. That rather than it becoming a very hard, fortified, exclusionary form of nature protection, which has historically been done and in really, really brutal and violent ways, how it can be based on a ground-up sense of respect for those scales and processes. That's something that I think could also be quite interesting, because it involves developing a novel form of culture where there is a rhythm to it based on annual cycling.
Yeah, exactly. Thank you.
Yeah, really lovely. I can't help myself. I have to jump in. I have something that kind of follows a little bit on that. One of the things that I was really struck with, that for all its challenges, something that I've really heard in the presentations now in this session is that there is something about nature-based health and therapy approaches that really actually it shows how they have impact beyond the physical, which is normally the sort of like home turf and domain of physiotherapists, right? Like it has these kind of social impacts, mental health impacts, environmental impacts, educational impacts, cultural impacts, etc., etc. And so the thing that struck me is that, okay, so actually, I think that somehow, I suspect we're going to keep fighting kind of that demon of showing that it's equally as good or better than, standard kind of physical applications. But maybe that fight actually, and sorry if I'm kind of, it's a weird framing, but maybe that fight is actually exactly won by showing that super tricky to phrase it, but that they're better than physical, kind of standard physical reductionist interventions because they're not reductionist, because they create surplus value beyond those reductionist measures, you know, like Louise said, what do we measure and what do we value, right? Like that kind of thing. So maybe it's because of the surplus value that this has like such like important meaning. And so then if I come to the surplus value, I come to one other term that a colleague of mine here at the University in Tromsø works with, is that actually, you know, maybe there is something to be said about thinking of nature-based health and therapy approaches and interventions under the heading or intention of the regenerative, right? Or restorative, if you will. And I mean with that, that activities, that people could participate in, that they engage in to be therapeutic, a little bit like in Betina's case, really, that actually restorative, regenerative, environmentally regenerative and restorative, socially so, culturally so, cultural kind of restoration also in those, and all of those kind of regenerative and restorative activities, and that surplus value of being regenerative for society, environment, health, is it precisely what determines the strength and value of healthcare interventions in a world where health, environment, and society are at such threat and kind of degrading ultimately in all sorts of ways? It's totally not a question. It's just my summary. It's just my summary observation, but I wonder if it triggers something for anyone that you might want to follow up on. And I'd invite that, of course. Yeah.
I can
Sure.
come in with
Yeah.
something here. I just think that we are actually at the moment that we have a momentum that we need to keep going on. And even though it might feel like that we are standing a bit still, but I think that's something is really happening now, especially when we also have like the sustainability, the big agendas of sustainability as well, that we all of us need to be aware of, also as health professionals and researchers. But I think that something that the nature-based interventions are really good at is also in terms of how can we weave in more prevention into our healthcare systems. Because what we see now is that a lot of diagnoses like cardiac patients, cancer patients, and so on, they suffer, many of them suffer from second diagnosis of mental health, stress, anxiety, and depression. So if we can weave in nature-based approaches into the regular treatments and rehabilitation, then we can prevent all of the mental health issues that is coming forth afterwards, and that is a thing that I think we need to look more into, and be more broad in our way of doing our practice.
Yeah, thank you. Yeah, and the other thought, sorry, just to follow up on what I was saying before, is that I was thinking, what if there's actually, just a point to be made about the fact that the way we've thought about healthcare so far, and the way we deliver healthcare kind of at large, or let's say allied health, physiotherapy, occupational therapy, osteopathy, etc. What if the standard way that we've done that, actually, if we think about this kind of bigger picture of like surplus value across all sorts of domains, actually, what if the standard approach that we've taken over the last, 100 years could be argued to come at a cost, like at a cost because it's reductionist, at a cost because, because it's not, let's say, socially, culturally, environmentally regenerative, etc. I don't think that that's being argued as much, as a kind of argument for nature-based interventions, but I feel like there is something there. Yeah, just a thought. We have somebody sitting here, she's busy with her children at home as well, who's really soon to be a professor, hopefully, who has extensively published in this space, actually. I'll see if we catch her later on. She's not on camera at the moment. Maybe we can get something from her as well. She's sitting in secretly. Yeah, still open floor for questions and reflections, not just questions.
Could I just say something as
Sure,
well?
sure.
Apologies for I'm not having my camera on and volume on much because I'm looking after a poorly 1-year-old. So apologies for appearance and everything. But I just wanted to say, following on from Louise's comment, that I think with eco-anxiety, with this it's becoming such a big thing amongst everyone, really. Well, you know, most people really. And so not only in using nature-based interventions for our treatment as a way of, you know, getting people in nature and getting all the mental health benefits from that, but also using it as a way to then educate our patients about the environment and sustainability and everything, to address not only the mental health issues that come from physical ailments or, you know, whatever's going on with them, but also the mental health problems that are coming from the eco-anxiety side of things. So we can kind of be killing two birds with one stone almost by engaging in nature-based intervention. So again, not really a question, but just a thought. But yes, thank you. Fantastic.
Yeah, absolutely.
Fantastic work.
Thank you.
Cheers.
Yeah, I think the other thing, maybe a question, you know, for me, it kind of goes via Richard, but then to everyone. You know, in Richard's presentation, and, you know, in parts maybe also in Betina's presentation, like, but especially, you know, in Richard's presentation, it really kind of like, I loved, Richard, how you connected it to sort of your local environment, and you kind of, you know, took us on this tour of, you know, different species, which you failed to put the names of the species on the slides. I was like, oh my God, I don't know how these, you know, what are these plants now? And, you know, but I think the point here was for me that it seems to me that actually there's something that like to be worked with in this nature-based health and therapy space that has to do with a real deep dive into one's, let's say, local and regional ecologies and environments. And I just wonder,
I think that,
yeah, go ahead. Yeah, go ahead. I just wonder kind of how important that is, and kind of, you know, I feel like that's something that maybe needs to be like lifted even more, that like really, you know, there's these deep dives into all of these diverse environments around the world that really is a meaningful thing in this whole space that we're talking about. Yeah.
well, I think something that something that's really, really important in terms of dealing with global environmental issues is the impact of the tourist industry. And the tourist industry under capitalism is about, a lot of the time, ticking boxes, ticking the number of countries you've seen off a list. It's about breadth rather than depth. Whereas nature-based connection, there is no way I will in a lifetime be able to name all of the species I can find in 1 teaspoon of soil in my garden. It's about going deeper into those local connections, which can provide a really fascinating journey. And actually, I had an earlier version of this slide where I used traditional Irish names for all the species and how it was written in previous scripts. And it was just, I was going so far down the well, I had to scrap it all because otherwise I would just get far too nerdy for anyone's tolerance here. And that says a lot for you guys.
Yeah. But I really think, you know, this kind of deep dive learning, you know, is there like maybe a deep dive learning about local and regional ecologies? Is there maybe something there that has a health impact, if you will? But I'll stop my babbling on, Clément, and yeah, and then after, yeah, Osa. Yeah.
Oh, hi.
Sorry, just Clément first, Osa. Yeah.
Okay.
Yeah.
Thank you, everyone, for the presentation. That was super insightful. I've got a question for for all of our speakers here. It's a very pragmatic question. I apologize for it, but for all the participants that may be interested in trying to move forward, I'm curious about what started your journey, and when you all started, what was the first bit, and what you did to start that journey that led you to present today at this conference. Because a lot of us are obviously interested in these matters and topics, and that's why we all are here today. And some of us may wonder, all right, so what do I do next?
All right, maybe to each presenter, 30 seconds for your origin story. Jess, do you want to start?
So I got involved in it because I was actually working as a researcher with one of my collaborators now, who is a public health physician and an ecologist. And he really opened my eyes to the links between ecology and human health, which I'd never appreciated. I always really liked ecology and actually thought about studying it, but never made those links. So I was working with him on some other projects and got kind of into it, and then started to reflect on when I'd worked clinically, how I already was doing a lot of this stuff by taking people outside, by encouraging them to spend some time in the garden, going for a walk in the park. So it was kind of innate in a way, but I never ever thought about looking for evidence because it just didn't strike me as something that there would be evidence, or that it was something that really, you know, needed a separate evidence base. And so I think it was kind of, yeah, just made sense to me. But certainly when I became aware of the links, that opened my eyes to all these things that I'd never thought about, particularly from that public health perspective.
Thanks, Jess. Betina, 30 seconds origin story.
I've always been interested in health promotion, and always also loved to be in nature myself. And then when I started teaching, I wanted to do more on sustainable development goals and do some elective courses for students. And I realized, I thought that our physiotherapy topics at our university needed something else for students, for myself, for patients, for people. And I started doing courses on sustainable development goals, and then especially in the wellness in the beginning and health. And then it's, you know, I saw how many topics is around it. Also, I started working with the inner development goals, created my own company also to use art and culture as a way to promote health. And nature is also just a natural part of that. And then I see how many students, yesterday I was teaching some courses, they need somebody like us to show them there's another way than just being inside. Some students who were from Faroe Island and Norway were there, and they have nature embedded in them, but they didn't know anywhere to put it in the way that, I don't know, traditional physiotherapy is framed. So to open the doors for people to think differently is what I love. And of course, to practice myself, to keep opening my eyes and doing things.
Thanks, Betina. Richard.
Well, really, healthcare is just a small subsection adjunct of what I do primarily. I originally qualified in a natural science program and worked in the environmental sector before the career change brought me into healthcare. So I'd been involved in ecological restoration, ecological historical research, activism with a few rewilding groups, and also, to be blunt, I'd also worked in the mining industry. It was something that became intolerable to me. But the aspects of health, culture, and environment were the foundations upon which I became a healthcare professional, rather than it being an addition to that journey.
Thank you. Louise?
Yes, so in my research, I started out in cancer rehabilitation, very clinically in its focus. And then I was presented to the new park that we were to establish at the Marselisborg Center, and I became a part of the planning team for how we should design it and which top priorities we should design it from. And that was, as I said, rehabilitation, local community, and climate change and the natural environment. So therefore, that very much became my research field. And then I very much use my very broad knowledge as a way to try to ask the questions into the healthcare setting as an anthropologist coming from outside, stepping into the to the health research field, and then asking the questions of, so how do we bring in this person-centered perspective, and how do we bring in more meaningfulness to people's everyday lives? And then I see the nature-based approaches as a really good tool and resource in doing so.
Thank you. Yeah, really lovely to hear. I'm always inspired by, people's different paths. Clément, I hope that was an answer to your question. My answer to how do you, if you're interested, get started, and what's the next step to take? I would argue that, if we follow these kind of origin stories, as I've called them, it's essentially like knowing where you stand and realizing that there's 360 different directions that you can go to as a next step. And whatever next step you take, then you kind of like go a little bit with the flow. It can take you places. I think it's kind of this creativity of realizing the possibilities taken from where you stand and then going further. Yeah, also, you had your hand up before. It would be lovely to hear you.
Yes, well, thank you. And thank you so much for all the presentations. It's been lovely to listen to, especially the part of what Louise said, I think, about what are we measuring and what kind of outcomes are we looking for. I think that is so important and a base in all healthcare, but especially this. I've worked in a nature-based rehabilitation for 4.5 years, part-time. So I worked a lot in a hospital, and then one day every other week I went to this facility and had that nature-based experience with the patients, the same type of patients. And for me, like traveling from the hospital and that settlement and environment and going backwards and forth, that was like really a wake-up call for what we need to do. Where I worked, we had a lot of animals as well. So so we had much of the being in the soil and the seedlings and all that part, but we were also with the farm animals. And I saw so many people that don't engage with animals in their daily life. And if we go back 200 years, that was like how we lived. That was the main way we lived, so close to the animals. So my question is, do you see that need, and do you see how people engage with animals, and how important would that be in the nature-based rehabilitation?
Hugely, I think. I'll just jump in here. I think that's a huge space that I think is totally underappreciated. And I think in physiotherapy, it's really odd because we have this niche space of animal physiotherapy. That's one of them. And then also animal assisted therapies in different ways. And very often those two spaces are quite marginalized in the allied health professions and in physiotherapy also. And I think that exactly this sort of nature-based health and therapy and environmental physio, etc., is a space that can bring those worlds together in a really beneficial way. So that's my take hugely. But we have time for responses from other speakers on this also. Maybe, yeah, brief ones if you have thoughts on it.
No, I do not have that much experience in the field, but I think it's really interesting, and I think that it's one of the pathways that we need to look more into when we are developing our nature-based interventions. Also because one thing is that now we are focused on our disconnection to nature, but I also think that this disconnection to animals that you are talking about here actually withholds some really interesting experiences. And just a lot of us are having animals in our normal lives, but we do not take them into the healthcare context. And I actually think that there are a lot of potentials there. So thank you for pointing that out.
And there is a lot of research there. Richard, yeah, last words.
I suppose one thing I would say is also we need to consider the role of non-domesticated animals. And that I fully agree that the relationship between animals is a really grounding, wonderful thing. But it also can be when we really connect with wild animals, that it informs a deep environmental ethic of how we interact with wild spaces, that we conduct ourselves in such a way that we are recognizing that we are sharing someone else's home. So I think recognizing animals goes above and beyond what we do with farm animals or pets.
Yes, Astrid, we're running out of time a little bit, but go ahead. Maybe you can pose a question that everyone can think about after. Yeah.
Okay, I make it very quick. I was thinking now of our limits of our profession, and I was thinking how with which other professions that maybe work in the similar area field should we connect with or work together with in this area of nature-based therapy? Because I think there is a lot of similarities, like if I think about gardening activities that occupational therapists do already, and yeah, I was wondering which other professions you think about.
So many. I'm gonna unfortunately have to cut us off here just for the sake of time. But thank you for that question. Absolutely. I think some of it was mentioned, you know, like even ecologists, you know, are people we need to probably connect to in these contexts, you know, all healthcare professions. Yeah, I'm absolutely fired up. I'm really inspired by this session and actually the one before. I'm loving how the symposium is going so far. Don't talk to me after this because it's a dangerous space for me. I'm likely to start all sorts of projects and let's do this and let's do that and oh my God, we could do this, and not a good thing. I have too much going on. But let me just share my screen with you here briefly. We have 2 more sessions to continue along these inspirational lines. The next sessions will be at 6:30 p.m. Central European Time and 10:30 p.m. Central European Time, both of that today. Loads more information about the Environmental Physio Association, you know, on our website, of course, and that's also a pathway to join, if you will, if you want. And what we'd really love is for you to also kind of, you know, fill in this survey. We're trying to hear a little bit from our membership and also sort of interested non-members, what kind of things you're interested in, not just in nature-based health and therapy, but, you know, environmental physiotherapy, planetary health, sustainable healthcare, etc., at large. So filling in this survey and giving us some information is a really helpful thing. Now, the recordings of the symposium will be available on the Environmental Physio Association YouTube channel. It'll take me maybe a few days, but we'll get that ready, and then we can review this and keep spreading and sharing the symposium as a whole also. Thanks again to the presenters for really lovely presentations and for an engaged discussion afterwards. And I'll see you at the next session, 6:30.